Dr. Snyder is here answering all your questions about COVID and Thanksgiving. One of the best parts about Thanksgiving is that big old buffet full of food. Is that safe? Should we do it a different way?
I would say that I would try to have one person portion out the foods as much as possible, especially just for other foodborne illnesses, not necessarily just COVID.
What are some other things we should worry about? Because we're so focused on COVID these days.
I'm a big fan of still advocating for the flu vaccine. As we head into the winter months, we're starting to see a little bit of a pickup of flu. And then also, plenty of people are going to be traveling to see family members. And especially if you're coming from a state or a region that has a lot of COVID in their community, that would be a great time to ask that family member to get tested before you come or the day of, either using an antigen kit. And then especially flying on a plane. I know the mask mandates are on flights, but there are different types of masks. I'm a big fan of the KN95 masks, those ones that kind of look like this, and ensuring that it has a good coverage over your face and and under your chin. And obviously on the plane, hand hygiene is a very big thing to do as well.
We had someone write in, how do you talk to kids about wearing their masks during the holidays and wanting them to keep it on?
I think it's a little bit easier this time around. I think our kids have been in schools for the most part, throughout this past year, and they are getting used to it. Still maybe a little bit of nudging as it may slip down, but still mention that, there may be family members that are very vulnerable, that still don't have enough immunity, and we're really we're wearing masks to protect our loved ones.
Hey, for people who do not like shots, they don't like needles, when are the pill versions of the vaccines going to come out?
You know what? That is a great question. That is not in the works quite yet that I'm aware of. I think some people confuse some of the storylines that are coming out about antiviral pills, and that is really for treatment right now. In terms of being fearful of needles, I think sometimes it is very challenging. There is also the J&J vaccine, which is only one shot, and then also trying to distract yourself, not to get too anxious at coming to get the vaccines.
And I'll definitely let you know, I didn't feel anything either. It was very quick and over just like that.
Yeah. And the children's vaccines, right? The pediatric doses for those who are ages 5 to 11, they are like a third of the dose than of an adult dose. And, kids tolerate that quite well. They still have received all their childhood vaccines and don't really, at least of the side effects, or I've heard of other children, they've actually tolerated really well without any issues.
What's it like trying to get kids vaccinated? How are we doing on that?
I believe looking at some of the nationwide statistics, it's still a little bit slow, but we're getting there. I think, there are a lot of parents who are, want to see what the first wave of kids getting vaccine, how they're tolerating it. And, there are numerous settings where you can get, there's vaccine sites, there are pharmacy sites, there's also pediatric offices that are doing it. So for families who feel like their kids would be more comfortable at their pediatrician's office, that would be a great site. But even the vaccine sites, they have really catered to kids, keeping it like a little bit more private for them. Stickers, lollipops, whatever you want, it's there.
Okay, we talked about COVID test already, but what about antibody test? How accurate are they?
Ben, that's a great question. We still have not had really good consensus of how to interpret the various antibody tests that exist. And even though your test may be positive, it may not quantify like how much antibody you have. And there have been plenty of studies now showing that even with having natural immunity, which we consider like the immunity you develop after having COVID, as versus vaccine-derived immunity, Both of those, you do very well initially, but over time they do fade. And so that's why either if you've had COVID and you've recovered or have had the vaccine over 6 months ago, the thought is everybody needs a booster vaccine.
Well, we're getting some more questions that are really interesting coming in that we're going to tackle after this next break, including someone in my family just had COVID. How long should we have to wait before it's okay to be around them? All of that and more of your questions coming up next.